Number three, hand therapy. So, just about 2 months later, I got that brace off. And the beautiful part of having the brace is that you can remove it for showering. So, I was able to keep it clean. And if you've ever had the pleasure of a cast, you know what I'm talking about. So, that was a godsend. And I was also able to see how scrawny my hand and arm was getting. It was a sad sight, let me tell you. Well, let me back up. The pin came out in office about 2 weeks prior to the brace coming off and starting hand therapy. So that was a bunch of lidocaine at the thumb, a slice, and he pulled it right out. Sweet, sweet relief. That pin was the bane of my existence for those 2 months. But instead of breaking my back, it murdered my radial nerve. Okay, back to hand therapy. I showed up. They take measurements and do an initial uh, assessment on the range of motion, where you were prior to injury, and what it is you want to accomplish through your hand therapy. And that was pretty easy because I basically had zero range of motion and I wanted to get back to full range of motion and strength prior to injury. So for the next 4 weeks or so was breaking up scar tissue, increasing range of motion. So each week I got a new motion to work on for a bit, some manual scar breakup, massage, etc. After each section, I would go home, go to work, and all throughout the day, I would massage and manually work on breaking up that scar tissue and increasing the range of motion. My main concern was with flexion and extension. I didn't care so much about the rotation. That came back pretty quickly. So after about 4 to 5 weeks, I had a lot of my range of motion back, and we had started using K-tape. It's a CrossFit tape you see. I'm going to butcher the word, kinesiology tape, to help passively break up the scar tissue. And I ended up buying my own and used it for a while, even after hand therapy had stopped. It's great stuff, but I have enough to last the rest of my life at this point. Uh, so I think it was around the 5th week, she tested my grip strength for the first time. Left hand was 50 pounds, right at infant level. My right hand was hanging around 140 still. I probably had a little more in that left, but due to fear of pain and damage, I held back. So I suppose maybe I'd been closer to 60, 70, but it might just be my ego talking, but not that it really mattered at that point. For strengthening, we started with the hand therapy putty. It was great stuff. She sent me home with some for the next few weeks, and I would just squeeze this stuff nonstop. I ended up going on Amazon and buying a hand therapy kit. It had 6 different levels of firmness, putties, donut squeezy balls, and finger bands and whatnot. I had already had the adjustable grip strength squeezer, and after a few more weeks of hand therapy, I had most of my range of motion back. Left grip strength was 83 when she did my final test. Once I was discharged from hand therapy, I continued with all the stuff that she had shown to break up the scar tissues, loosen the muscle, worked on the putty and the finger bands. My poor emaciated arm was slowly coming back, and I had a few months until I had my final post-op appointment, and I wanted to be as far advanced as I could. To kind of give an overview of what I was using the hand therapy kit, basically I would start with the lowest of the putties and then just work my way up. I do like 30 seconds to a minute, 2 minutes, 5 minutes, whatever I was doing at the time. But basically, it would be a cycle or a circuit, I guess you would call it, of squeezy putty, finger bands, back and forth, back and forth, back and forth. And then I would work up to the grip squeezer. So I'd basically just grip this all around, do a lot of thumb pinching to just work everything. And it was actually really helpful for the sensation of my hand to come back because there was a lot of sensation issues with the nerves. So there was a lot of this each step up, about 30 seconds to a minute, especially if I was just like warming up. So this was the hand putty, work all the way up to extra firm. So then I would follow it up with the finger bands. I would just grip my wrist real tight just to brace it. And then with the easiest one initially, I think it's like 6 pounds or something, 20 reps. And then I just stuck with the easiest band until I could just get 6 sets of 20 reps real easy, full extension, real strong. As that improved, I went up to the next weight band, so on and so forth. Now with these little donuts, it was mostly just working pincher strength just thumb and finger, just pinching. That was the main thing I would use these for. And that would come up to the Fit Beast. I think that's what this is. It's just an adjustable grip strength thing. So basically, I would do 10 regular reps and then 10 pincher reps, thumb and finger. Give it a full spin, get another 10 reps in regular, and then another 10 reps with just the thumb and index pinching. Keep on going. 10 pinchers. And I would just do that until I'd maxed it out. 10 regular, 10 pinchers, get it to the end, and then I would drop set it once I got it all the way max to the end. For a while, I obviously couldn't get a full grip strength, but after a while, I was able to get all the way to the end on my left hand.